Hi, welcome to another episode of Let's Talk About This. I am your host, Crystal Hicks. My guest today is Phindile Chowa. I thought I was going to mess that name up. Hi, Phindile. It's good to have you on the podcast.
Good
How
to
are
be
you today?
here. I'm doing great. I'm so excited to be here to talk about it.
Yes, I'm glad to have you on. Let me just give the guests a little bit about yourself. You're an expert in personalized postpartum care and helping new moms navigate in their fourth trimester with compassion, holistic support, and advocacy. Yeah, let's get right into it. So, the first thing I want to talk about is you have a book. You're also an author.
Yes,
Okay.
ma'am.
And give me a little bit detail about the book because I don't have the book. I haven't saw the book and read it yet.
hmm
But could you give me a little bit of detail about the book and what inspired you
Yeah.
to write it?
So I have a book and it's called What to Expect Next. And the reason I wrote the book, one, it was mostly because of my personal experiences postpartum. A lot of us hear about pregnancy, there's so much information out there about pregnancy and childbirth. And then when you get into the postpartum period, it's like a truck hit you. What you thought was going to happen did not happen. The village you may thought would be there was not there. And so a lot of moms go through this like crisis of like, oh my gosh, I didn't know I was going to struggle with breastfeeding. I didn't know I was going to have these aches and pains. I don't even know how to navigate my life or what to do. And so they're in this crash mode trying to adjust to the changes, especially in that first 12 weeks. And so I wanted to create a guide that basically helps moms know what to expect. So in it, I talk about the different changes that the body may be going through in that first 1 to 12 weeks after you deliver. I talk
Hmm.
about, concerning signs and symptoms, like how much bleeding is normal, right? How is your mood today, right? Checking in with their mental health. They're checking their blood pressures. They're constantly scanning their body to basically look out for dangerous signs and symptoms while also getting a word of encouragement along the way. I have quotes. I also encourage moms to basically plan out their village. So it's one thing to say, oh, my family's going to be there to help me. But the
Right.
reality is, people just don't show up. You
That's
have to
true.
notify people, you have to write a plan down. And so I just help moms think through that process so that they can have a plan when they're in that postpartum period. And so that's how I came about writing the book.
Yeah. So, what experiences did you have to deal with during your fourth trimester of your pregnancy?
Yeah, so for me, it dates back. I can't tell about my postpartum story without giving a little background.
Okay.
So before I had my child now, who's 6 years old, I did suffer one miscarriage. And so when I was going through the pregnancy with my child, there was a lot of fear. There was a lot of, just anxiety surrounding that pregnancy about whether I was going to lose her or not. And so I
Right.
went in through that entire pregnancy just having a lot of fear and anxiety. And then I gave birth, and my birth story was difficult because after she had to be induced, and then during that period of time, she went into respiratory distress. They had to put her on a breathing machine. She ended up in the ICU. And then everything that kind of came out of that was just deepening postpartum depression because one, my breast milk didn't come in. So I struggled a lot with lactation and breastfeeding. And then I had to struggle with the guilt that comes with that, giving my baby formula. And then the support, right? I didn't have a supportive environment that was, there when it comes to just being encouraging about the breastfeeding issues and just helping me along the way.
Right.
And really, I was just faced with my own inability to cope, right? That was the first time in my life that I decided to see a therapist. Before then, it's not something that I would have thought that I needed.
Right.
But really after struggling a lot postpartum with the anxiety, the postpartum depression, the breastfeeding issues, I really needed help. And
Right.
a neighbor came to me and basically talked about her own experiences with therapy. And so that's how I got to that position. So I would say that's my struggle was really deep postpartum depression, which just stemmed from all the trauma that I had experienced leading up to that point.
Right, right. Yeah, because they don't really give you a lot of management after you give birth,
Mm-mm.
with your children. I could think back at when I had my first child. I do remember this was in the 80s. I'm telling my age now.
Mm.
This was in 85. I gave birth to my daughter.
Mm-hmm.
And the only thing I could remember is they did give us a mother and father's dinner
Mm-hmm.
afterwards. They did a lot back then, like they would
Mm-hmm.
prep you before you gave birth. Today they don't do a lot of that stuff anymore, you know?
Yeah. Yeah, they don't do a lot of that because I personally think that people are overwhelmed, right? I think the physicians are overwhelmed. The midwives are overwhelmed. So there's a lot of work to be done, right? They have to OBGYNs are delivering babies or having surgeries or seeing patients in clinic. And so it's like there is that attention when you're pregnant, but then once you're
Mhm.
postpartum, it's really you're kind of forgotten about until that 6 week period. So everything you're going through from 0 to 6 weeks, you're just dealing with it and trying to figure it out. But
Yeah.
they don't give dinners anymore, mother father dinners. If I don't think
Yeah.
I even
No.
heard of that.
I don't think they do at all. Yeah, but they did this back in 80, yeah, in 85 when I gave birth to my daughter. It wasn't a lot of postpartum uh as far as like giving us information as to what to do once we got home, with my
Hmm.
child. But you're right about that. That's interesting that we're having this conversation because it's a big change,
Hmm.
from especially a person who hasn't had a child and they have their first child.
Hmm.
There's a lot of things you need to know as far as, like you said, breastfeeding, things of that nature. So why is personalized care, um, um, postpartum personalized care? What does that actually entail?
Yeah. So, and how I got into this field was, I left my full-time job in the emergency department. And I decided that I was going to do a field of medicine called concierge medicine. And what
Okay.
that basically means is you provide direct care to the patient. So instead of going through, a business or a hospital or insurance companies, I am contracted directly by my patients. So, like, for example, you would hire me to be your doctor, right? And so I don't have all the bureaucracy that comes with, insurance, with billing. Me and you have an agreement. I'm your personal doctor. I look at you as an individual, right?
Mhm.
And I see how I can tailor your health to your needs, right? Oftentimes in medicine, and standards are not bad, right? This is how we create patterns and we help our patients because we'll say, of all these 500 people, this, disease will present in this way, right? And so
Right,
standards are good. However, everybody is not necessarily going to be according to the standard. People deviate from that, right?
right,
Everybody's not going to present with chest pain who has a heart attack. Some
right.
people may have nausea. Some people may have this. And so if you don't know your patient well enough, you're not going to be able to tailor to look for those little signs and symptoms that say, okay, her situation is different. She's
Hmm.
not presenting to the textbook. And the reason I think this is important for postpartum care, right? We see in the news how many women are dying after giving birth, right?
Hmm.
People think maybe when you're measuring maternal mortality, so the amount of women who die during childbirth, people are thinking all of those deaths happen when a woman is pregnant or right
Right.
when they're giving birth. But a lot of the deaths hope happen after they give birth, right?
Mm.
And so there has to be some hypervigilance, some more awareness in that 0 to 6 week period, really, of trying to figure out if women are at risk. And so,
Hmm.
why personalized care is important, right? Is I go to a mom's house and I talk with them. Right
Hmm.
after they give birth, I sit down and I talk with them, right? And I go through all the checklists. Are you experiencing this? Are you experiencing that? Because maybe for one mom, they've been having a headache and feeling tired for the
Right,
last 7 days, but they don't think anything of it because
right.
maybe they think they're tired. And so it's asking the right questions. It's building relationships with your patients so that they may feel comfortable in talking with you. And then it's
Mm-hmm.
it's really creating a plan for them, because
Right.
maybe one person will be fine waiting to 6 weeks to see their doctor, but someone
Right.
else is struggling at home and they may not say anything. And so having
Right.
that personal relationship with them, you really pick up on a lot of emergencies that otherwise would have just gone unknown if they just kind of sat in their home and waited for that 6 week postpartum visit.
Right, right. Now, how does that insurance play? I know
Mhm.
health insurance plays a big factor. What about women who can't afford to have that postpartum
Mhm.
care? You know what I'm saying?
Yeah. So I think, insurance is one of those misunderstood things that a lot of people
Yeah.
don't know, right? And I sit down with my clients because sometimes people think, well, my insurance should cover all of this, right? I don't know if you've ran into a case where you've gone into the emergency department and you say, I'm insured, it should handle all of this. And
Right.
then you get that $3,000 bill and you're like, wait a minute, I thought my insurance covered all of this, right?
Right.
And so, the point I make with people is that with insurance, there's deductibles, right? And so people are picking these high deductible plans because they're paying lower premiums at the end of the month, right?
Right.
Let's say their premium is $500, but they're thinking everything is covered. But the reality is their deductible is higher. So they're going to pay out of pocket for
Right.
everything, everything.
Uh,
And so for those people, I always encourage, how does personalized care help that? Well, a lot
mm-hmm.
of these concierge plans now, they're not just for the elite, right? You can get a concierge plan for $100 a month where you have unlimited access to a doctor. So
Okay.
you can literally have a doctor on your phone. You have a cold, you have a prescription emergency, you want to talk to somebody, ask a question. You're
Right.
calling your doctor directly. You're not going through, trying to get an appointment and it's 6 months in advance. And so
Mm-hmm.
number one, it's cheaper for some people, especially if you have a higher deductible plan. It's
Right.
cheaper if you don't have insurance because you're paying way less, right?
Right.
And also, you have access to a doctor, your appointments, you're not waiting 6 months. And so, people who have these plans generally have better health outcomes because, one, they're able to get the care that they need in a quicker way. So,
Right.
I think some people feel like personalized care, concierge medicine, this is something for the wealthy, but
Mm-hmm.
it's not anymore. You could literally go online, Google direct care practices, and they have affordable plans so that people can get the help that they need, and they could work with your insurance, right? A lot of
Right.
insurance plans may not cover personalized care,
Mm-hmm.
but they can cover, you can get reimbursed for some of these services, and your health savings account could be
Right.
used to pay for some of these services. So it's not for everyone, right?
Right.
But there's so many affordable plans there. If you have
Right.
insurance that pays 100% of everything,
Mm-hmm.
probably not going to benefit you. The only benefit I would say is, can you reach your doctor in that plan? If you're getting 100% coverage, are you getting the care that you need? Do you feel close to your doctor? Do you feel heard? Do you feel advocated for? Do you feel
Mm-hmm.
that you're having improved healthcare outcomes?
Right.
And so you just have to evaluate and sit down with somebody who's knowledgeable about these things and say, with my insurance, can I afford this? Does
Mm-hmm.
this make sense? So it all depends on what kind of insurance you carry.
Oh, I see. Okay,
Mhm.
so what are some common challenges that new mothers face that personalized care can address?
Yeah,
Yeah.
I would say the biggest challenge that mothers face, I think, is the mental health
Uh,
aspects of things.
yeah.
I break it down into, there's the physical challenges, there's
Mm-hmm.
the mental challenges, there's emotional challenges, right?
Mm-hmm.
The physical challenges that mothers face are really your ailments, knowing what's normal, because we don't
Right.
often talk about these things, right? We say, if you have extra vaginal bleeding, let us know, call us up, right? But what is
Right.
a lot of vaginal bleeding? Who knows what
Right.
that is?
Right.
If you're having a headache, call us up. Well, what is a bad headache if I'm not sleeping at night? Like, what does that look like, right? And so there's those physical changes that a woman goes through, those elevated blood pressures. That's a
Mm-hmm.
huge one, especially in the African American community, is
Right.
high blood pressure related conditions of pregnancy, which
That's,
don't end after you give birth. A lot of
that's
women get
true.
diagnosed with high blood pressure after they give birth, but they may not have the symptoms that they warn you about, right? So
That's true.
they'll say if you have a headache, if you have blurry vision. I had a couple of cases where I go in and I check on a mom and I'm called in for one thing and I always check a blood pressure and their blood pressures are through the roof. And I'm saying,
Mm-hmm.
do you have a headache? No. Do you have blurry vision? No. Well, you need to go back into the hospital because you need to be treated. And they get back into the hospital and they're diagnosed with preeclampsia after giving birth, but
Mm-hmm.
they would have not had any symptoms, right? So
Right.
that's one way that personalized care can catch those things, right? It's just screening moms for these diseases. That's the
Right.
physical stuff they go through. The mental, emotional things is like a lot of women feel like they can they could suffer, they could tolerate. They feel like they have a high tolerance rate. And so a lot of women struggle until things crash and burn.
Mm-hmm.
So they kind of just sit at home, they don't want to deal with things. They don't want to talk about things. They may think that if they tell people what they're experiencing, that they may get their children taken away, that they
Mm-hmm.
may face judgment. And so a lot of women end up not talking about the feelings that they're experiencing when it comes to
Right.
depression and
Yeah.
anxiety. And these things really can propose a risk to their child and
That's true.
themselves.
Mm-hmm.
And as Black women, we have higher rates of mental health disorders in pregnancy. And so, unfortunately, we don't seek care at the rate as other women. And that's historically, you can think of the reasons why that is. There's a
Right.
stigma surrounding it,
Right.
there's a fear of the healthcare system surrounding it. So,
Mm-hmm.
having a relationship with a doctor and having a personal experience with a doctor really mitigates these risks because
Mm.
you know for a fact when you go to a hospital and you're able to talk with your doctor about an issue frankly, you're able to express everything that you're going through and
Yeah.
not feel like you're going to have be
Right.
judged. But individuals have a hard time. The majority of people, if you talk to people, did you talk to your doctor about that? No.
Mm-hmm.
I don't want to bombard them. No.
Mm-hmm.
I don't want them to think I'm like, I'm not listening or
Right.
people just don't have these relationships. And so that's really
Yeah.
the benefit of having a personalized care plan is that you build a relationship with your doctor. You
Yeah.
have a straight conversation. There's no insurance in the middle. There's no,
Right.
billing system,
Yeah.
everything is transparent. You know what
Right.
you're going to get. You know how much you're going to pay. Everything is transparent.
Yeah, yeah. That's one of the things I learned is that it's two people you should never lie to yourself and your doctor.
Yes.
I was I tell my doctor
Yes.
everything because,
Mm-hmm.
especially when it comes down to your health, because, that you're only going to be risking things to happen to yourself,
Mm-hmm.
But you always got to be honest with your doctor. How can family members and support system be involved in personalized postpartum care if
Yeah.
the
So.
family was to want to get involved?
So I think families need to educate themselves on things to look for. That's number one.
Mm.
I have women get my book early on when they're pregnant because in it there's
Right.
exercises they can write and it says who is your support system? And then it says, have a conversation with them about how you need them to help you, right?
Mm-hmm.
And so you're educating your family on things to watch out for, right? Like,
Hmm.
hey, if you notice X, Y, and Z, if you notice that my face is swollen or my legs are swollen more than usual, or if you notice that my mood is changing, and try to have a conversation with me. But if you find that I'm having a difficult time, try to bring it up to my doctor. Here's my
Right.
doctor's phone number, just in case you need it. Here's who you can call, just in case you need it. And a lot of moms also just don't know what they need when they're postpartum because
Right.
they're shocked at what's
Right.
happening to them, and so they really don't know what they need. And so it's really trying to anticipate your family members needs and be able to check in with them. And the biggest thing I say is when you go visit a mom after she gives birth, the tendency for most people is they want to go and hold that baby. They
Mm-hmm.
go they go
Yep.
straight to the baby, they
Yep.
ignore mom, and that is what they want to do. I encourage you to don't go straight to the baby, to go straight to mom, make
Mm.
sure mom is okay. If mom has, dishes in the home that need to be washed, if mom needs to eat, make sure mom is eating, make
Right.
sure mom is drinking, make sure mom is sleeping. Those should
Yeah.
be the first things that you do before you hold that baby, because you may not even know mom may even have anxiety about you carrying her child, and you literally just, set
Yeah.
her anxiety level off. And so
Yeah.
try to check in with what mom needs, because baby's always going to be taken care of. Baby is seen, I think, when the baby is
Yeah.
born, they have to see a pediatrician like the next day after their discharge, and
Mm-hmm.
a week later they're seeing a pediatrician pretty frequently. And so baby is always going to be checked on, but mom notoriously is neglected. And so focus
Yeah.
on mom at all times. And if mom needs you to focus on baby, then she'll tell you, but go straight to mom first.
Yeah. Another thing I want to mention too is back in the day when I was giving birth to my kids, they
Hmm.
would keep you in a hospital a little bit longer. I mean,
Hmm.
I remember being in the hospital. I think I stayed in longer because, like you mentioned earlier, my blood pressure was up. So I was in there for like 5 days. Um,
Hmm.
but today things are totally different. Okay, you give birth and you're only in there for what, 2 days, is it? And then they
Yeah.
send you right home.
Yeah.
So to me, that's not enough time to be monitored after giving birth. Do you
Yeah,
agree?
I would agree with you. However, I don't know if hospitals are would be the best place to monitor moms. And I use the example, if you look in France and some of these other countries, there's systems in place that are built so that nurses go to the mom's house, pelvic
Mm-hmm.
floor therapists go to the mom's house, lactation consultants go to the mom's house after they deliver. So there's a
Right,
constant eyes on mom, but it's happening within their own home. If you imagine, a lot of moms don't necessarily have interaction with the healthcare system apart from when they're sick.
right,
Childbirth is one of those happy things that happens in the hospital.
right.
Most other things that happen in the hospital are not good. And so, moms are not used to being in that hospital environment. The
Mm-hmm.
best place for moms to recover, if possible, is in their homes. But the problem with our society today is we send them home and we don't check on them.
Right.
Right.
Oh,
And
right.
and so
Yeah.
that's the issue. Like if
Yeah.
if they stay in the hospital, yes, they would have more monitoring, but
Right.
the longer you stay in the hospital, then the more interventions you're gonna get, because, we just
Yeah.
I'm a doctor, sometimes you just be
Yeah.
checking things to check things. There's no sleep. We're checking your vitals.
That's
And so
true.
the best place for a mom to recover is in their home. But if
Mm-hmm.
that's the case, moms need to be checked on. And, there's just needs to be better systems. There's a lot of birth workers out there. There's doulas, there's lactation consultants, pelvic floor therapists. There's a lot of people who want to be involved.
Mm-hmm.
But as a society, we need to figure out better systems to involve these individuals in mom's care,
Right.
because a lot of moms don't even know these people exist. And
Right.
so they
That's
go
true.
home and they struggle alone.
That's true. That's true. Because I didn't know anything about doulas or
Hmm.
any of that or postpartum care or any of that. I'm thinking back to when I gave birth to my kids. Basically, I had to learn a lot of things on my own,
Hmm.
and but it's good that people know that you can have postpartum care after giving
Hmm.
birth. Now, let's switch over to holistic approaches. Are there holistic approaches included in personalized postpartum care? Yeah.
Absolutely. I think the wonderful part of working with a doctor who comes to your home, the wonderful part of working with a doctor who is hired by you, is that there is joint decision making. You never feel pushed into one area. I take, for example, I took care of one patient who had mastitis. So they got a clogged duct that turned into a breast infection.
Mm-hmm.
And they did not want antibiotics, right? And so they wanted to figure out how to treat this thing. And so they were having fevers. And so for days, they were trying to figure out how to break up the clogged duct. They were using warm compresses, vibration, taking supplements, everything that they could to try to get past this blockage. And, when I saw them, I said, you know, if we can't get through this, one, I think we're going to need to do antibiotics, or and see a lactation consultant. But they
Mm-hmm.
were not really, they're like, I just don't want to do it, doc. Can we just try X, Y, and Z? Can we try X, Y, and Z? And I said, that is fine. These are the things that you need to look out for. These are the
Mm-hmm.
risks. This is when you know to go into the hospital, right? And
Right.
as long as we're having a conversation about that, I'm respecting their wishes. I'm
Mm-hmm.
I'm allowing them to make an informed decision, that
Right.
informed consent. And so I'm allowing them to explore holistic approaches. The
Right.
beautiful part about, being a concierge physician is I get to also learn from my patients who come to me and they said, Doc, what do you know about this? Right. And if I don't know about it, I
Mm-hmm.
go off, I do my research, I go and figure it out and see, and I allow them to try it. If it's not going to
Right.
harm them, if it's not
Right.
going to harm them, I allow them that flexibility to try. I think oftentimes in medicine, we get stuck in like, this is how things are.
Right.
And so we are not always as open to try things or open to allow our patients to explore different things. A lot of us physicians barely got a nutrition class in medical school. I mean,
Oh,
there's
really?
our nutrition curriculum is not,
Wow.
maybe medical schools are different and they're changing now. But
Right.
when I went to medical school, we didn't have an in-depth class on
Right.
nutrition. These
Right.
are things that, you have to go off and you learn on the job, you learn on your own,
Right.
but a lot of us know how to treat a lot of conditions. We know what medication is good for that. We know the physiology behind a condition, right?
Mm-hmm.
But when it comes to coming up with a tailored diet plan for a patient in order to help them through something, we pass that on to someone else. We pass that
Right.
on to a nutritionist. And it's great we have nutritionists.
Yeah.
However, we also have to have that knowledge. We also have to be able to counsel our patients on, hey, these things here's a diet for this, or look at these supplements, or try this. And
Yeah.
so I do think, holistic approaches are more, accepted when you talk about personalized care and having your concierge doctor, because they care about you. They care
Yeah.
about your wellness. And there isn't all this other stuff in the background that they're dealing with, insurance companies, billing,
Right.
it's about getting you on the track of being healthy. That's
Right.
the sole purpose in taking care of you and having that relationship, is to get you to the point where you are better. And so, whatever you need to go through, whatever process that you need to go through, they're going to listen to you and are going to be more understanding to try and explore these other approaches. Because let's just be honest, a lot of people don't want to be on medication.
Yeah, that's true.
And medication is not the solution for everybody,
Yeah.
right? And so I think as long as people are informed on the risks of
Mm-hmm.
things, you know, that's just, you have to allow people to go through that process. And that
Yeah.
means sometimes that patients are going to choose the wrong decisions. And you
Yeah.
have to be okay with that. You have to be there, right? As long as it's not putting you at risk, your license at risk, that patient's life at risk, you have
Right.
to be comfortable with patients making choices that you may not always agree with 100%.
Mm-hmm. Yeah, because I had I'm thinking back to when I had my surgery. I didn't want to have a blood transfusion.
Mm-hmm.
And they scared me. They was like, "Well, if you don't get this blood transfusion, you know there's a risk you can die."
Mm-hmm.
And so I took the blood transfusion,
Mm-hmm.
but I'm one of those people who like to um do things more holistic, more natural. I
Mm-hmm.
don't like taking medication. I take medication because I have to, but if
Mm-hmm.
I can prevent from taking it, I would rather not have any medication at all,
Mm-hmm.
but I think you're right that that patients should be more educated as far as alternatives that they can use rather than, you know, taking medication. Because a lot of people just don't want to take medication. I know my mother was that way. She just refused to use medication, you know?
Yeah. Yeah, I mean, it's a challenge, right? Because, I'm in the emergency department, so I work with life and death situations a lot.
Uh-huh.
And so, I have these conversations with people who don't want to take their blood pressure medications, and usually they're at death's bed because I'm talking about conversations where their heart is affected, they're having a stroke, they're having, complications where their kidneys are failing. And so
Mhm.
those are difficult conversations because those are
Yeah,
life and death situations. And
they
so I
are.
have to I have to say, you will die if you don't take this medication.
Right.
You will not be the same if you don't take these medications. And so there are instances like that where it is a life or death situation where I
Mhm.
say, this is what it's looking like for you, right? But then there's other instances where a patient may say, I may say, hey, your cholesterol is high. We
Mhm.
need to start this medication because otherwise you're at risk of having a heart attack, right?
Mhm.
And then they'll say, Doc, I just don't want to take medication. Can you give me 3 months and help me with, my diet or help me set up? And I'll say, okay, hey, you see our company nutritionist. I'm
Mhm.
gonna set you up with her. She's gonna come up with a diet plan for you, an exercise plan. We're going to try this. And in 3 months, we're going to come back and we're going to recheck your blood test and see where we are. If things
Mhm.
are doubling, I'm going to bring up medications again, right? Or
Right.
if you're not doing what you need to do, I'm going to bring it up.
Right.
Why? Because I know the higher your cholesterol levels are for the longer period of time without you doing anything,
Right.
that's putting you at risk for having a heart attack. I'm going to bring it up. You are
Right.
an individual, you have a choice to make,
Right.
right? I just have to tell you those risks so that you are aware of those risks at the end of the
Mhm.
day, because I don't want somebody when you go into the hospital and now you've had your stroke or you've
Mhm.
had, your heart disease, and they're saying, wow, you've had these cholesterol levels that have been elevated for so long. Why
Mhm.
didn't your doctor have that? But I can say, you can say, he had that conversation, he or she had that conversation with me. This was the
Mhm.
choice that I made. And, I respect her for respecting my choice.
Yeah.
Um, we just get in society, especially in the US, we want to fix things. We want to fix everything. We want to throw medications.
Right.
We don't want to accept the fact that someone's choices may lead to a bad consequence, right? We don't want that. And
Right.
so, when a patient says no to us, when we know that that is going to lead to a bad outcome, it's
Right.
a really tough place for us as physicians. And
Yeah.
it's that risk tolerance, that balance you have to have with your patients. But these conversations go better when you
Right.
have a relationship with someone because
Yeah.
they know you're looking out for them. They
Right.
know
For
you
them.
care about them deeply.
Mhm.
And so
Right.
they can make a better choice.
Yeah, yeah, especially when you have that relationship with the patient, like
Hmm.
you said, because I'm thinking back to when I had my after my surgery, there was this one nurse. We had this really good relationship,
Hmm.
and she was like the only one that I trusted,
Hmm.
when I was in the hospital. I remember, well, I was in a hospital for a month. I had a bad accident. So I went from a hospital for a month and then I went into a nursing home rehab.
Mm.
And
Wow.
the nurse was um I mean, we became friends. I mean, it got to that
Mm.
point. So it was like I didn't want anybody to come in my room but her because she was the only
Mm.
one that I felt like I can trust. So
Mm.
but like you said, having that relationship with the patient is very important because it puts the person at ease.
Mhm.
It really does. What recent innovations or trends are shaping personalized postpartum care?
Yeah, technology.
Mm-hmm.
I would say that I think you're going to see a lot of this. You're going to
Mm-hmm.
see a lot of doctors moving away from traditional medicine and taking practices that are, using combined models with insurance and so
Mm-hmm.
and self-pay.
Right.
You're going to see them moving away from these systems and really trying to start their own practices and building these relationships. Reason being, the technology is allowing this to happen, right? We saw with
Right.
COVID, telemedicine just skyrocketed. Before, people were using it, but very infrequently. But
Yeah.
when people couldn't move out of their homes, they
Yeah.
were able to have conversations with their doctor, right?
Yeah.
You can, now there's remote monitoring systems where your patients can, you could monitor patients' vitals through the phone. You could see how
Wow.
patients are, yeah, you
I
could
didn't know
see how
that.
patients, yeah, you could see how patients are doing, in the comfort of your own home.
Mm-hmm.
There's just a lot of technology that allows you to take care of patients in the home. And this is important because, with our boomer generation, I think is it called the silver wave? Something like
Mm-hmm.
that. It's either the silver wave or it's uh the geriatric medicine in the future. Basically, what's
Right.
happening is our baby boomers are aging, and there's not going to be enough resources to take care of them in the hospital. There's probably not going to be enough manpower,
Mm-hmm.
doctors. You're going to see shortages of nurses. And so we have to get creative in taking care of this generation in their home. So you're
Mm-hmm.
going to see a lot of models of care that utilize technology, that utilize doctors going to meet the patients where they are,
Mm-hmm.
utilizing ambulance systems to take care of patients in their home. I think there's even a company maybe in Boston that basically is able to have many hospitals in patients' homes so that they may get the care that they need while a
Mm.
doctor is monitoring them from far away.
Um,
So
right.
all this personalized care is really important as we're moving into the silver wave where our baby boomers are aging, and insurance companies are going to have to figure out ways to incorporate these systems as well, because we can't do it without them,
Right.
but at the same time, they sometimes can be prohibitive in actually providing this level of care. So
Right.
there will be a balance, but I think technology is going to come and accommodate for a lot of this silver wave for sure.
Yeah, yeah. I see this new technology they have now. You can do mental health care
Mhm.
over the
Everything.
phone, and
Hmm.
everything is just changing now, and it's changing
Hmm.
fast, you know.
Yes.
So but it's good for people who don't have access to get to certain places too, you know,
Hmm.
which that plays a big role for a lot of people, I think. Yeah.
Absolutely, absolutely. You talk about the seniors. You
Yeah.
talk about postpartum patients. You talk about patients with young kids. A lot of my patients have children, right? You think
Right.
about you. One baby gets sick. You wake up in the middle of the night. The baby's sick. There's nothing open, and in the morning now you have your partner may be at work, and it's you with the children. What are
Right.
you gonna do? Leaving your
Yeah.
house is a huge headache, and so having access to a doctor who can talk to you through a screen, having somebody who can come to your home saves you time. It saves you anxiety of taking all those kids and logging them to, places where there's, germs.
Right.
So, I mean, when you talk about convenience, there's certain people who just can't, they don't have the luxury to get up and go
Yeah.
to the clinic to be seen.
Yeah, that is so true. Yeah.
Mhm.
What are some recent innovations or I mean, has tech this is another question I want. Has
Mhm.
technology impacted postpartum care uh in a personal way? Like
I mean, I would say maybe in a positive way, right? Because
okay.
we're all learning more about these, with postpartum stuff, right? I think there's a
Okay.
lot of attention now. You would think that as a developed country, like, the United States, that we would have better maternal mortality rates, right? But
Right.
we are now seeing that it's not the case. We're able to learn more. People are educating themselves.
Right.
There's, the Instagram, the social media, there's TikTok. People
Yeah.
have quick access to resources.
Right.
They can Google, they can learn about things. And so moms now are becoming more versed. These, moms know what's up, right? And
Right.
so
Yeah.
they're able to go online, they're able to, look up things and ask questions and
Mm-hmm.
challenge their providers. They're able to bring things up before people come to them. And so there's an access to resources, the information that's out there.
Mm-hmm.
Um, and then two, they can find things, they can find providers. You said when you were having your kids, you didn't know that there were doulas and lactation and all these other important people. Now,
Right.
a mom who has the access to technology, they can find themselves a doula online. They could, look up, try to get an
Yeah.
appointment for lactation, and they could
Yeah.
schedule these people online. And then they can also have telemedicine appointments. So
Yeah.
it's impacting it in a positive way. I think
Yeah.
when you think about changes, I think now it's imperative to integrate these models of care, and
Mm-hmm.
so everybody coming together and having women be able to have access to all these resources at
Yeah.
once.
Yeah, yeah, yeah. Because I have to think back that I remember, see, back in when I was giving birth, they didn't have all this technology, and
Mm-mm.
they didn't have, I don't even think I had a cell phone back then.
No, no,
We didn't
you're
have
just
cell phone.
struggling. You're
Yeah,
just
so
struggling in
we
your
couldn't,
house.
yeah, we couldn't pick up a phone and Google and do
Mm,
research and all this kind of stuff,
mm,
So things have
no.
changed a lot when it comes down to technology and healthcare. Um,
Absolutely.
so what are some misconceptions about postpartum care that you see?
Um, that I think the biggest misconception come from it from mom's standpoint. I think maybe they feel like people are going to be looking out for them a lot more.
Okay.
And so that's one misconception for moms. Just know that you actually, this is the time when you have to advocate for yourself more than anything.
Right.
And so the misconception that, oh, my doctor's following me all this time now, and that
Yeah.
like now that once I give birth, it's going to be this ongoing thing. That's a no. You have to, get that. People think, there's this term like it takes a village to raise your child. The unfortunate reality with our society now is that you have to build a village. You got to notify the village. Sometimes you
Mm-hmm.
got to pay for the village. And
Mm-hmm.
so people are not going to come knocking down your door saying, "Oh, you had a baby." And like,
Right.
here, nobody is going to come to your door if you don't notify them, if you don't
Right.
plan, if you don't tell them what you need. Sometimes you may pay for that extra care, right? Like,
Mm-hmm.
if you know that you are at risk, or maybe your baby was in the ICU or you were in the ICU, and you may need to pay for somebody just to have a closer eye on you because
Mm-hmm.
your doctor may not do that. And so the
Yeah.
biggest misconception is that your village will just appear. It's not
Yeah.
always the case. And so here is a time you have to advocate for yourself.
Yeah.
And then the other biggest misconception is that like your insurance is going to cover all of these things.
Right.
And it's not always the case. Again, try to research what your insurance covers before
Yeah.
you have a baby so that
Right.
you're aware. People don't know that insurance will cover your lactation consultant, your pelvic floor therapist, depending
Right.
on your insurance, but you got to know these things. And so I would say, people just have to do their research and advocate for
Yeah.
themselves. And that would be the biggest misconceptions I would say is that people just they don't know what their insurance covers. They don't know that they are going to have to pay out of pocket for some things to get
Right.
the level of care that they need
Right.
and deserve, honestly.
That's true. That's true. Now, where can people find your book if they wanted
Mm.
to get your book?
Absolutely. So they can find my book. It's on Amazon. It's What to Expect Next.
Okay.
And yeah, and I also have it on my website. So my company website, if you're in the Georgia area, is www.emcare, the number two letter u.com. And probably in the next month, I will have drchoa.com up and running again. It's just under construction right now. But you can, if you Google it, type it in Google, What to Expect Next, you'll
Okay.
find it. It pops up right there. Purchase it. It's a great baby shower gift. If you're having a baby shower, hosting it, this is a great book to get for a mom.
Yeah.
Let's skip the baby gifts. Let's think about gifts that really can impact mom's
Right.
well-being.
That's true. That's true. Oh, Pendy, thank you so much for stopping in and sharing so much information on postpartum care. Because like we were saying earlier, a lot of people don't realize that there is resources out there as far
Hmm.
as getting care after giving birth to a baby,
Hmm.
which is important because, like I said, back in my day, we didn't have all this information. We didn't have all these resources and technology that they have today. So it's important for people to utilize that,
Hmm.
this information. And I want to thank you for coming on. Do you have any social media handles you want to share and throw
I
out there in case people want to
do.
follow you?
I do. So I'm on Instagram at Dr. Choa. I'm also on Facebook under the same name, Dr. Choa. And then there's my business handles, which are at emcare2u. And I'm on
Okay.
YouTube as well. And my YouTube channel is Dr. Choa. So super easy to find.
Yeah, you have a podcast too, right?
Oh, thank you so much. Yes. So I had, thank you.
I just thought about that when
Yes.
you said
Oh my
YouTube.
gosh. Thank you. Yes, I have a podcast and it's called Fourth Trimester Voices. It's a great podcast for pregnant and postpartum moms and really anybody who wants to learn about the fourth trimester because there's a lot of things there that people are not going to tell you. And so we
Right,
talk about it. We hear from other moms who have gone through it, and we hear from birth workers who tell
right.
you what to look out for and how to keep well during a very stressful time in your life.
Yeah, yeah. Well, thanks again for stopping on. And for the audience, I'm sure you guys when you see this episode, you're going to get so much good information out of this episode in regards to, postpartum care. Pendy, thanks again for stopping in. I really appreciate you. And for those who are watching, make sure you like and subscribe to the channel. The only way that I can get people like Pendy on the platform is for you guys to subscribe and we'll see you next week for another episode. And Pindy, you take care of yourself. I did say your name properly
You did,
this time.
yeah.
But thank you so much for stopping in. I appreciate you.
All right, it's been lovely. Take care.
Take care.